Stillborn screening is our state-based programs, so that brings in the government aspect of them. And they've been going on since the early 60s. In fact, this year is the 50th anniversary. So it's the PKU test. But now that's expanded to more than 30 conditions on state panels across the country. The perception has been for many years that the tests are so important for kids that parental permission is not necessary. So now only Wyoming and the District of Columbia have a parental permission process. So what that means is the information is not required to be given to parents about these programs. So there is a brochure. All states have brochures, but the brochure sort of goes in the bottom of the bag when you've had a new baby. And most folks who've just had a baby aren't looking at the bottom of the bag to the brochures. So folks are poorly informed about this phenomenon. So what's become controversial in recent years is that many states will save the leftover blood spots. After the tests are done, they'll save the leftover blood spots, as is done across much of clinical medicine in general. The residual tissues are saved. And those may be available in certain circumstances for research. So parents in Minnesota and Texas became aware of this situation, brought suit, and for the most part they lost those lawsuits because parents said, subsequently research we've done, and we talked to folks in detail about it, the basic answer is we support research, we get it, we think it's a good idea, but we want a choice. So how do you then build a choice into a phenomenon that is conducted at the population level? Where you have states, Utah's a relatively small state, but we have some 53,000 kids born a year. States like California, New York, of course, may well have 1,000 kids born a day. So how do you develop a system that has meaningful conversation with people about this complicated choice? And is it okay to proceed with this do you need an opt-in system? Do you need people's signatures? Is an opt-out system okay? So these are some of the issues that we're trying to deal with now. So it's sort of the biobanking issue in a particular context. It's also sort of the Rebecca Skloot, the Immortal Life of Henrietta Lacks issue in a little different context. People are thinking about that book and that particular case without actually recognizing that that's going on all the time now in a variety of different contexts. So how to inform people, the nature of the choice that we as a society want to give to parents around these issues, and how to manage those spots in a way that will promote public health while honoring people's informed choices about that is really a pretty serious fundamental problem. And my point of view has been that the actual risks associated with it are pretty close to zero. Nobody's had an instance in which there's been any harm to people that have come from this type of activity. But when you talk to people, they say, that's a piece of me or my baby, and I wouldn't have thought the state was saving a piece of my baby. What's that all about? And how could you do that without asking my permission? So you sort of have to balance what are two very legitimate, important, but competing considerations.